I'm Joan Stauffer with Iridex Corporation here at the American Academy of Ophthalmology. I'm with Dr. Larry Morse, Professor of Ophthalmology and Director of Retina Services at the University of California, Davis. Dr. Morse, thank you for being here and for participating in our speakers program today. So when did you first start using MicroPulse, and what are the various indications that you treat?
So I started using MicroPulse very shortly after many of the initial studies in the late 1990s came out. And we acquired a MicroPulse laser. I think the indications for using MicroPulse are very broad right now. Because it doesn't cause damage, it's very applicable for diabetic macular edema. I've used it for central serous. I've used it for CME from vein occlusions.
Dr. Morse, you had conducted a study on MicroPulse as an adjunct to anti-VEGF in DME, and your results were recently published in the European Journal of Ophthalmology. So can you summarize your study and the results?
Sure. So we wanted to ask the question of whether or not we could reduce the treatment burden in patients that had diabetic macular edema that would usually get anti-VEGF therapy. And so we had two arms to this study. We took treatment-naive patients, those that had never experienced any diabetic macular edema treatment of any sort. None of them had any lasers and no prior treatments. And we had the two arms. The upshot of that treatment is that after 12 months of treatment, we reduced the treatment burden that was needed in the treatment of anti-VEGF therapy by about 60%. If they got a prior MicroPulse treatment therapy. And the reason that probably works is I think it's producing the same anti-VEGF therapy that the anti-VEGF therapy is actually doing. So it's an additive synergistic effect. And so we're very pleased. I think we're looking forward to doing a randomized prospective trial on this. And it's going to be one of the treatment paradigms, I think, that'll help us out in the long run.
And what would you say to your colleagues who are still a little skeptical about MicroPulse?
It's very hard to do a treatment that you don't see anything from. The beauty of MicroPulse is it does not produce tissue damage. And so the therapeutic endpoint that we have doesn't play out in this particular treatment. So you have to be patient. You have to use confluent therapy, and that produces a large clinical effect from the retina that's actually producing anti-VEGF molecules that will actually turn the case around. It takes a while. It can be used over and over again. I've done it up to 3 times. I usually use 3 months in between the treatments, but it does work alone, but it also works very well in combination with other traditional therapies that we have.
Thank you. We have additional talks at AAO. You can find our complete speakers program at iridex.com or stop by our booth 2545 to pick up a schedule of all physician presentations. We also invite you to stay connected via our social media channels for the latest news and additional videos.